We're back now with our NBC News investigation into Medicare Advantage, those Medicare-approved plans offered by private companies. Millions use them, but we found they routinely reject claims for necessary care. As Sam Brock reports, it's devastating hospitals in rural America.
This was once the geriatric psychiatry unit at Alliance Healthcare in Holly Springs, Mississippi. Now the hallways hollow and beds sitting empty.
This operating room only a few years ago was doing 5 or 6 procedures a day. Now, 0.
Dr. Kenneth Williams is the CEO. He says the hospital can no longer afford the unit or any inpatient care for that matter.
All of this used to service people that really needed help, and now it's just totally empty.
It's empty, it's gone, and it died the last few years with Medicare Advantage.
Medicare Advantage is a private alternative to traditional Medicare pitched by celebrity spokesmen like Joe Namath.
Medicare Advantage plans have added new benefits.
31 million people are on the plans, which are often cheaper than Medicare supplements and promise better benefits and lower premiums. But the CEOs of rural hospital systems in 6 states tell NBC News that Medicare Advantage routinely denies reimbursements for necessary care.
2006, we went from being well in the black to losing $1.7 million.
Overnight.
Medicare Advantage. Yeah. And all of a sudden, we went from smiling to crying. And nothing changed other than that.
One government report found the top Advantage plans denied payment for nearly 1 in 5 claims that met Medicare rules.
Your fight is not just to take care of patients anymore. Your fight is becoming more to get paid from the insurance company.
And without the resources to push back, rural hospitals like Dr. Williams's are forced to eat the higher costs.
How dire is the situation when it comes to rural hospitals?
More than 300 hospitals that are at immediate risk of closure, and another 300 that could be at risk of closing in the next 6 to 7 years.
When Rose Stone retired, she signed up for a Medicare Advantage plan.
Rose, how long have you been coming to Dr. Williams' clinic for?
20 plus years.
And did you think if you signed up for Medicare Advantage, you'd be able to continue to do that?
At first, I did.
She was later surprised to learn the plan didn't cover her visits. Faced with paying out of pocket, she made a difficult choice.
I had to stop coming to Williams' clinic.
An advocacy group for Advantage plans tells NBC News they acknowledge the challenges facing some health systems, but we need to ensure coverage is maintained for millions of seniors. Rose has since gotten rid of her Advantage plan and is seeing Dr. Williams again.
You felt like you were taken advantage of.
I know I was. Yeah, I know I was.
Sam Brock, NBC News, Holly Springs, Mississippi.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.